This conference will now be recorded.
So good morning everyone. Somebody please respond. Are you able to hear me? Is it audible?
Yes, sir.
Okay, we'll start. So today's class I am going to talk about National AIDS Control Program. So in India we had a new disease. So with patients are presented with different signs and symptoms. So which are not correlating with any of the diseases which are existing at that point of time. So we don't know what has happened. So at that point of time, especially in Chennai, they have identified a new disease. The first case which has occurred in India is it at Chennai only. That is in 1986. If you look at the history, a person presented to the hospital with different type of signs and symptoms, and it is not correlating to any of the existing diseases. So they don't know where to keep him, how to treat him. So they consulted with the WHO and other organizations and other health organizations, and finally they came to the conclusion that it is most probably it will be the HIV, that is human immunodeficiency virus, were diagnosed among sex workers in Chennai, that is Tamil Nadu. So India's first case, that is in 1986, of HIV were diagnosed among sex workers in Chennai, Tamil Nadu. First AIDS case surfaced in Mumbai, Maharashtra. Then the full-blown AIDS, that is acquired immune deficiency syndrome. Syndrome is nothing but a group of diseases. So this in 1987, the first case of AIDS has been identified at Mumbai, Maharashtra. And in 1987, the government of India has decided to start a program on this, that is National AIDS Control Program was launched to coordinate national responses. Its activities covered surveillance. So what are the activities that this program is going to take up? That is surveillance, that is nothing but the continuous scrutiny of the factors which are responsible for causing the disease, and then blood screening. So we need to screen as many people as possible, so that we want to find out how many people are suffering with this HIV or AIDS. And health education, that is this is a new disease, nobody knows about its signs and symptoms, and what is the mode of spread. What is the mode of spread of this disease? Nobody knows. So we need to educate entire India at that point of time. So in 1987, the government of India has started a program that is called as National AIDS Control Program, right? So the main thing is to coordinate with the response, national response. So what are the activities of this program at that point of time, that is in 1987 is, so at that point of time, nobody knows what is HIV and what are its signs and symptoms, its modes of transmission. That means the general public doesn't know. That's why the main aim of this program is to educate the public, about the signs and symptoms, its modes of transmission, and its preventive measures. And then blood screening. So we need to know how many people are suffering with this disease. So that's why what they have done is they want to do the blood screening for majority of the population, and then surveillance. So what are the factors responsible for causing the disease? So all these things they want to study under this program in 1987. So by the end of the year, out of 52,907 who had been tested, around 135 people were found to be HIV positive and 14 had AIDS. So in that particular 87th year, what they have done is, so they have screened almost 53,000 population, to the round figure 53,000 they have screened, and they came to know that out of 53,000 population, 135 are having HIV. So HIV is different and AIDS is different. You see, HIV means entering of the HIV virus into the body. So virus is present in the body. It has not blown up into different diseases. Whereas AIDS is acquired immune deficiency syndrome. That means it is a full blown disease the person who is having HIV over a period of 10 years or 15 years, depending upon the immune status of that particular person. So he will develop different types of presentations or different types of diseases, that is full-blown AIDS, that is acquired immune deficiency syndrome. So only 14 had AIDS at that point of time. So if you look at the from 1990 to 92, medium-term plan has been adopted, and then 1992 the government set up NACO, that is National AIDS Control Organization, to oversee the formulation of policies, prevention work, and control programs relating to HIV and AIDS. So in 1992, what they have done is they have started a new organization that is called as NACO, National AIDS Control Organization. So the main aim of this organization to see the policies, prevention work, and control programs relating to HIV and AIDS. So 1992, the government launched a strategic plan for HIV prevention. This plan established the administrative and technical basis for program management and also setup of state AIDS bodies in 25 states and 7 union territories. So what they have done is in 1992, after establishing the NACO, so under this NACO, so in all the states they have established state AIDS control bodies in 25 states and 7 union territories. So in 2001, the government adopted the National AIDS Prevention and Control Policy. So 2001, they started a policy that is called National AIDS and Control Policy. From 1992 to 99, National AIDS Control Program, that is NACP1, was going on, and 1999 to 2006, National AIDS Control Program 2, NACP, was implemented. 2006 to 2011, NACP 3 being implemented. So National AIDS Control Program phase 2. So in the phase 2, what are the action plans or what are the objectives of this program is at that point of time, the main objective was to reduce the prevalence of HIV or to reduce the spread of HIV infection in India. The main objective at that point of time is to reduce the spread of HIV infection in India, to strengthen India's capacity to respond HIV AIDS on a long-term basis. So at that point of time, we need to stop the spread of the disease in the country. So that is the main objective they have taken up. That is in the phase 2. And to strengthen the capacity. Capacity means different what you say, investigative procedures, workmen. You need to have working people in that particular program. Skilled people must be needed. Infrastructure must be needed, and then we need to get support from different organizations. So the people must come forward and participate in the program. They must undergo testing voluntarily. So all this long-term procedure they want to take up. So mainly first point what they want to is they want to reduce the prevalence or reduce the spread of the HIV infection. Plus they want to strengthen the system. So the system they want to strengthen to fight against the HIV and AIDS. So interventions to be achieved by the end of the project, that is to decrease the prevalence of HIV. Whatever program you take, whatever it may be, AIDS control program or vector-borne disease or any other disease program, main aim is to reduce the prevalence only. So similarly for NACP2 also, the main objective was to decrease the prevalence of HIV, to reduce blood-borne transmission of HIV to less than 1%. So blood-borne transmission of HIV to less than 1%. So at that point of time, blood transfusion was considered as one of the major source of transmission. So that's why what they have done is they want to reduce blood-borne transmission of HIV to less than 1%, to attain awareness of more than 90%. That means at that point of time, awareness levels was very less. That's why what they want to do is they want to rampantly go into the society with different channels of communication, so that they want to communicate about the HIV to all the people, to the grassroots, up to the from top to grassroots level. They want to create awareness among the people about the HIV, AIDS, its modes of transmission, its preventive measures, and everything they want to place in the society, so that people can know about it. So to attain awareness of more than 90% among the youth and people in the reproductive age group. So because mainly reproductive age group are mainly concerned with this disease, that's why they want to make at least 90% of the reproductive age group people, they must know about this AIDS, HIV AIDS, its modes of transmission and the preventive measures. So to achieve condom use of more than 90% among the high risk categories. So mainly high risk categories means all the you can see prostitutes, transgenders, IUD users, intravenous drug users, and then men having sex with men, then transgenders, truck drivers. So these are all come under high risk category under this for this particular disease AIDS. That is transgenders, homosexuals, then prostitutes, then long distance truck drivers, and then sex workers. So all these are drug users, intravenous drug users. So all these categories, they come under the high risk category for this particular disease. So at least 90% of the such type of people must use condoms so that they can prevent the spread of the disease from one person to other person. So that is to achieve condom use of more than 90% among the high risk groups. See in phase 3 what they have taken up. See, first point is they want to reduce the prevalence. Simple. These are the main steps for every disease. So first they want to reduce the prevalence and they want to reduce the blood transmission, the blood-borne transmission, right? And then they want to create awareness in the society up to 90%, and then to achieve condom usage by the high risk groups by 90%. So these are the 4 points they have taken up in the NSCP phase 2. So what are the initiatives of NSCP phase 2? That is prevention. First one is the prevention, second one is the care, third one is the collaboration, fourth one is building capacity. See, simple. First one is the main aim of this program is prevention. Second one is those people who got the disease, they must be given care. The people who got the disease already, they must be given proper care. And then to strengthen the capacity, so we need collaboration from all the different sectors, that is collaboration, and then building capacity. So we have to build up our capacity so that to fight against the HIV and AIDS. So these are the 4 initiatives of phase 2. You see NSCP phase 2, the initiatives taken up by the government of India is prevention. Number 1 is prevention, second one is care, third one is collaboration, fourth one is building capacities. We will see one by one. So prevention is mainly among 2 types of populations are there, that is high risk population and then low risk population. So high risk population, I already discussed, they are the transgenders, sex workers or the prostitutes, and then men having sex with men, then long distance workers, intravenous drug users. These are the high risk group. So among them prevention and promotion of healthy activities is very important, right? And then among the high risk population, the targeted interventions. So targeted, you have to target the high risk groups, discuss with them about the disease, about the HIV transmission and everything. Ask them to use condoms as during the time of intercourse, so that they can stop the spread of the disease from one person to another person. Then STD treatment. So it is very important, sexually transmitted disease treatment. That is syndromic approach you have to do. Syndromic approach you have to go. That is STDs. If you find any STD patient, sexually transmitted disease patient, you have to screen him thoroughly and treat the STDs as early as possible. Treat the sexually transmitted infections as early as possible. Then condom programming, that is most important. You have to promote the condoms in the high risk population so that at least 90% of them use the condom. And it is multi-sectoral collaboration, so you need to get support with all the other departments. Multi-sectoral collaboration, that is we need to get support from education side, police side, and then from other sectors. What are the sectors surrounding us, surrounding health departments? So we need to get support from all the sectors so that you can reduce the spread of the disease in the society. And you need to have public private partnership. So this is a public private, you have to interact with the private organizations. The government has to welcome the private organizations, NGO organizations, private institutions to come forward and participate in the program, so that you can reduce the prevalence of the disease in the society. So people's participation is very important. Maybe public, or it may be private, or it may be NGOs, or it may whatever it may be. So you need to get as much of support from as possible from the society, so that you can reduce the transmission of the disease in the society. So that's why these are the high risk populations. You need to, for high risk population, you need to do the targeted intervention, STD treatments, condom programming, multi-sectoral collaboration, public-private partnership. So these are the strategies, or these are the preventive measures you have to take up. Whereas in the low risk population, that means the general population. So you have especially social mobilization. That means people will be moving from one place to another place for their basic needs, or for their daily wages, or something like that. Among them, you have to create the awareness about the spread of the HIV, about the transmission of HIV or a sexually transmitted disease. You need to aware them about the HIV and its modes of transmission, and then safe blood transfusion. That is most important. Before transfusing the blood to others, you need to screen the blood thoroughly. You need to screen the blood for all the viruses, especially for HIV, and then you have to go for transfusion, and then you have to arrange voluntary counseling and testing centers. So if you create awareness in the society, automatically those people who are having some sort of doubts, they will come to the VCTC. So there they will undergo counseling, and after that they will undergo testing procedures. Initiating AIDS. So about talking about the AIDS, what is HIV and how it will turn up into AIDS. All those things you have to create awareness in the society. Sensitizing youth and adolescents. So the major part, because this part of like this disease is mainly you can see this disease among the youth and adolescents, because they are in the reproductive age group. So you need to focus more on the youth and adolescents. So you have to sensitize them about the reproductive tract infections, sexually transmitted infections, and then about the HIV AIDS, and then personal hygiene, safe sex practices. So all these areas you have to sensitize the youth and the adolescents. So next one is care. So low cost care and support. So you have to support the people, those who are suffering with HIV, and then you have to see that you have to prevention of parent to child transmission. So the parent is having the HIV, don't think that the child will get 100%. No, there are so many cases are there where the transmission where you can prevent the transmission of disease from mother to child. So a lot of things are there. So you have, if you follow them, if you follow the protocol properly, definitely you can prevent the spread of the disease from mother to child. So the prevention of parent to child transmission, management of HIV TB co-infection. So HIV means automatically your immunity will come down. As a result of that, you are prone to develop a lot of infections, lot of co-infections. The most common one is the tuberculosis. So how to manage HIV and TB, and treatment of opportunistic infections. This is most important. Treatment of lot of opportunities, especially fungal, bacterial, and viral diseases. You will get a lot of bacterial, fungal, and viral diseases you will be getting. So how to treat them, and what are the treatments available for different types of opportunistic infections. Everything you have to you see that they must be in place and they must be followed promptly. And piloting ART, that is antiretroviral therapy, and post exposure prophylaxis. Suppose if you are unknowingly, if you are exposed to a HIV person, so what is the post exposure prophylaxis you are going to take? So all these things, so care of the society, care of the individual is very important. So these are all the steps you have to take up. That is low cost care and support, that is prevention of parent to child transmission, management of HIV TB co-infection, treatment of opportunistic infections, piloting ART, post-exposure prophylaxis. So these are the care which you have to provide to the society. And then collaboration. So that is intersectoral collaboration. So you need to involve, you need to get support from all the ministries and different departments surrounding you, like social department, or the science, or the engineering department, or the health, or the police, or fire, whatever departments are there surrounding with you, you need to get our education system, nutrition. So all the departments which are surrounding you, you need to get support from them. And then workplace interventions, then public private partnerships. So you need to interact with the private organizations. So you have to invite all the private organizations to come forward and to support with you, to work with you. You must provide provide place for them so that they can work easily with you. They must get collaborated with you. And public, that means government and private organization, must work for the specific cause to reduce the prevalence of HIV. So that's why then only your program will become success, and you can definitely reduce the prevalence of HIV. Partnership with other stakeholders. So those who are interested, you have to invite them, ask them to participate in the program. Involvement of PLHA, that is people living with HIV and AIDS. PLHA means people living with HIV and AIDS. So you can involve them, educate them, so that you can utilize them in the program. You can utilize the people living with HIV AIDS, you can utilize in the program for the spread of awareness, or for health education, or for other supportive purposes. You can utilize them. So you need to involve the people who are having HIV AIDS also. So this is the collaboration. So you have to get collaborated. That means you need, for successful running of the program, you need to get support from the private organizations, not only from the government, from the private organizations, NGOs, and then from other departments in the society, from the society, as well as you have to include the people living with HIV and AIDS. So this is the collaboration which you have to establish for the successful running of this program. And then building capacities. So how will you build capacity? That is institutional planning. So institutional planning means it gives program management. So your program must be managed thoroughly. And surveillance systems you have to establish. That means continuous scrutiny of the factors which causes the disease. That surveillance system you have to establish. Program management, number one is program management. Second one is surveillance systems you have to establish. And then AIDS vaccine initiatives. So you need to work out on the vaccines, whether you are able to come out with a vaccine as early as possible, so that you can prevent this disease. So that also you have to work out. And then training. So training the staff to overcome, or to fight against the HIV/AIDS. That is also most important. You have to train them thoroughly in all the aspects. You have to improve their skills, so that they can work in the society properly, so that they can get the information properly, and you can stop the spread of the disease. Then evidence-based strengthening. So what is this evidence-based strengthening means? So you need to set up annual surveillance system. That means you have to get up the surveillance system, set up the surveillance system in the entire society, so that you need to get the information periodically from all the surveillance centers, and annually you will see what has happened at the end of the year, whether the prevalence is increasing or decreasing. So what are the factors responsible for this high prevalence? So how to work out with them, and what are the necessary changes you have to make in the program? So you have to think like that. Suppose when they started, they are having only 135 cases. So after 1 year, if they get 1000 cases, that means the prevalence is increasing day by day. That means it is increasing day by day. So you have to reduce it. So if you do for annually, if you observe what are the factors responsible for that, if you do the surveillance, you will come to know what are the factors responsible for the increasing of the disease. So if you know the factors, you can reduce them, and by the way, the prevalence will come down. So annual surveillance means continuous scrutiny of the factors that are responsible for causing the disease. And then AIDS case detection. So how many AIDS cases are coming? So how many are there in the society? You have to you can detect, and you can see annually how many cases are there. And then mapping high risk groups. So you can map. So you can see what are the high risk groups. You can map them. So which are responsible for causing that. And behavioral surveillance. So what types of behavior are more dangerous? What type of behavior? So behavior of the people will be changing from time to time. So you need to study the behavior of the people. So in which type of behaviors it is most common, which type of people are most affected, that also you need to study. That's why behavioral surveillance system also we have to establish. The national AIDS prevention and control policy. So if you look at the objectives, reduction of impact of AIDS epidemic. So the main objective of this control policy is they want to reduce the impact of this AIDS epidemic in the society and bring about a zero transmission rate of AIDS by the year 2007. So the main objective what they have this policy has taken up is they want to make zero transmission. So there should not be any transmission from one person to another person, or through needle injury, or through the blood transfusion, So all transfusions must come down to zero rate of AIDS by the year 2007. So all the transmissions must come down to zero by 2007. So these are the objectives they have taken up for AIDS prevention and control policy. Next one is blood safety program. So only licensed blood banks to operate. So what they are doing is they are giving licenses to the blood banks with certain regulations or with certain guidelines. So those blood banks which follow their guidelines only, so they are going to provide the license. Otherwise, they are going to cancel the license. So if you get the permission, you need to follow the guidelines given by this National AIDS Control Policy, National AIDS Control Organization. People, you have to follow the guidelines thoroughly, and the intermittent checking will be there. Now and then checking will be there in the blood bank. If at all they are practicing any illegal activities, so their license will be cancelled. To encourage voluntary blood donation. So what they are doing is we need blood because for antenatal as well as for traumas, antenatals as well as for the trauma, we need blood transfusion. So immediately what they have done is for filling up of these blood banks, so they asked for voluntary donation from the people. So those who are interested, they can come forward, they can donate the blood. So while collecting the blood, ensure safety in collection, processing, storage, and distribution of blood and blood products. So when you collect the blood, so whatever the guidelines are the standard operating procedures given by the NACO, you have to follow. According to that procedure only, you have to collect the blood, store the blood, process the blood, and distribution of blood and blood products to the other person, that you have to do it based on the guidelines, standard operating procedures given by the NACO. So establishment of zonal blood testing centers. So they made it zone zones. So zone wise they are going to establish testing centers. Testing every unit of blood for HIV, hepatitis B, malaria, syphilis, and HIV is mandated. So we already discussed that. So any person who donates the blood, so the blood is tested for all the viruses like HIV, hepatitis B, and then HCV. Then for malaria and syphilis also it has to be tested, and that is made mandatory. So if you don't test for syphilis or malaria, that blood issue you cannot issue for transfusion. Then what they have done is establishment of blood storage centers at the first referral units. So in the first referral unit means definitely it must contain blood storage facility. FRUs, that is first referral units, all the first referral units must contain blood storage units, and they have to store the blood. Counseling and HIV testing. So HIV testing to be carried on voluntary basis. So initially what they thought that, so they want to start VCTCs, that is voluntary counseling and testing center. That means people who are interested or people who are having doubts, they can come to the VCTC where the counselor will be there. So they can the counselor will explain about the procedure, the risk factors, the modes of transmission, the signs and symptoms, and the treatment facilities available. Everything will be explained to the person who comes for it, and then after that the person will undergo the testing, HIV testing, and based on the test he will be given counseling again. So what they have done is they thought that people will come voluntarily for counseling and testing, but it became failure. Nobody came forward to undergo counseling and testing. So appropriate pre-test and post-test counseling has to be provided. So when a person enters into the counseling center, so pre-test will be there and post-test counseling will be there. That means before conducting the test, the person will be explained about the HIV, its modes of transmission, its prevention, and the treatment facilities available at that point of time. They are going to be explained to the patient. After that, he will undergo the test. If the test is negative, so again they will do the follow-up after some time. If the test is positive, then where to go, whom to approach, and when to take the treatment, everything will be explained. Where to take the treatment and how to get the treatment and how to follow the treatment, everything will be explained to the person who turns into positive, right? So VCTC centers, their counselor will be there. He will be providing counseling to the person who enters into and asks for doubts. So establishment of voluntary counseling and testing centers, provision of social and psychological support to those affected by HIV/AIDS. So that's what I am saying. If the after the post test, after the test, if the person turns out to be positive, so post test counseling will be there. So where they are going to give social and psychological support to the persons affected with HIV and AIDS. So psychologically as well as socially, they will support them. They will strengthen them, support them, encourage them, motivate them, so that they can live happily by taking antiretroviral therapy. And the next one is STD control program, sexually transmitted diseases control program. So what this program will do is management of STDs through syndromic approach. So if a person walks into your clinic and walks into this clinic and say if he is having some discharge of pus, discharge of pus is there, or any pain while passing the urine, or some sexually transmitted disease is there, or gonorrheal disease is there. So if you send the culture and sensitivity and everything, it will take 1 week time to get the report, at least minimum 5 days. So by the time what happens, he will that person cannot come back to you, or he may go to another place, or he may leave the town. Maybe he may go to another state. So you will be missing, and that fellow will be spreading the disease to others also. That's why what the government has done is, it is better to manage through syndromic approach. Syndrome is nothing but group of diseases, having a group of diseases. So you can approach syndromically and you can treat them straight away. You can send them for culture and sensitivity. At the same time, you can start based on the signs and symptoms, you can start the treatment, right? So that person will be taking the drugs, and after 4 or 5 days the report will come. Again, you can, if you want, you can change the treatment, or you can continue the treatment like that only, right? That's why what they have done is, it is better to treat the sexually transmitted diseases in the form of syndromic approach. Next one is integrating services for treatment of reproductive tract infections and sexually transmitted infections. So RTIs as well as STS will get the treatment at one place at one point of time. So that will save the time and money, as well as the patient will get the benefit out of it. That's why what they have done is, they have integrated STIs and RTIs. So the doctor who is present in that particular clinic, he will be trained in the treatment of RTI as well as STIs, so that a patient walks in with RTI or with STI or combination of both. So he will get the treatment at one point of time, at one place, and time will be saved, and you are protecting the patient, starting the treatment immediately, and you are doing the investigations whatever is needed by him. So training all the medical and paramedical workers engaged in providing STDs or RTA service. So we need to train, because what we have done is, we have done the integration of RTA and STA. So we need to train the paramedical staff as well as the medical staff in that particular aspect, so that if a patient walks in with RTA as well as STA combination signs and symptoms, he can treat them thoroughly at one point of time, at that particular point of time, at that particular place. So that's why what they have done is, they have trained all the doctors and paramedical staff, paramedical workers, in identifying the STDs as well as reproductive tract infections, and medical staff for treatment. So for medical doctors, treatment wise training was given, whereas for paramedical staff, identifying the STDs as well as the STD signs and symptoms, as well as the reproductive tract signs and symptoms, how to identify them, when to bring to the hospital, when to bring them to the hospital. All these things that were this paramedical staff were trained. And utilization of NGOs for counseling services at the STD clinic. So you can utilize all the, because previously we told that we have to take the help of private organizations, NGOs, or whatever is available in that particular place. You have to take the help of them. So you can utilize the NGO services for counseling services at the STD clinics. Then comes the condom promotion. Like you can see, 85% of HIV infections are due to unprotected sex and multiple partner contacts. So what is happening is mainly because of lack of awareness. Majority of the people, they are doing unprotected sex and having multiple sexual partners. So that is the main reason. That is the main reason. So for them, it is better they can use condom promotion, because we do behavior change communication. That means we try to explain them about the different types of diseases when they go for unprotected sex, or if they have multiple sexual partners, what are the social, psychological, and the health wise complications they are going to get. We are going to explain them. We will ask them to stop all that activities. At the same time, what we do is we explain them about the condoms, how to prevent the unprotected sex, and how to prevent the sexually transmitted diseases. All these things we are going to explain, and what are the uses of condom, and everything will be explained to those persons who are having unprotected sex and having multiple sexual partners. And then this can be prevented by consistent use of good quality condoms. So what we will explain them about the use of condoms how to prevent sexually transmitted diseases by using condoms, and all those things you are going to explain to the people. Issues to be addressed. So what are the issues when we tell that tell them to use the condoms? What are the issues that will come from the public? That is, how to sensitize the people about the utilization of the condoms. So it is very sensitive matter, because majority of the males, majority of the females, they are not interested to listen, because it is a sensitive matter, because it is about you can see it is about the sexuality. They don't come forward to discuss openly. Or sometimes among the males also, majority of the people, they don't express properly about their multiple sexual partners. So if in the Western countries, it is in the Western countries, they openly come out and they explain about their sexual practices, their partners. So their contact tracing is very easy. See the difference here. What I want to, they will be having multiple sexual partners, but in the Western countries, what they say is they come out and they explain. They will say openly that I am having contact with so and so, like that, so that it will become very easy for you to trace them, to identify them, educate them. So you can provide the condoms to them. You can explain them about the HIV and all its transmission. But in case of a country like India, so people are feared, and they don't come out openly. They don't. They will be having a lot of multiple partners, but they don't explain. They don't express it properly. As a result of that, contact tracing will become very difficult. So how to address this? How to sensitize the people about the utilization of the condoms? So for them, you have to identify and you have to explain them about the condoms and its uses. How to convincing the commercial sex workers? So how you are going to convince the commercial sex workers? So majority will will give complaints on different directions. So that's why how to convince the commercial sex workers, and how to make low cost and good quality condoms. So how to prepare them, how to manufacture them, so that everybody can be given at low cost, or at even if not low cost, free of cost also, the government is ready to give the condoms. Progress made by the NACO in condom programming, that is quality control of condoms by specifying parameters as prescribed by WHO. So whatever the WHO guidelines given for the manufacturing of the condom, so those guidelines were perfectly followed and the quality was maintained, and using the social marketing strategy for condom promotion. So they have utilized a novel solution, that is social marketing strategy for condom promotion. So condoms will be distributed in that manner at very cheap cost. Involvement of, that means condoms will be available at all the places, at all the stores, so that people can go there with minimum amount, they can get the condoms. Involvement of NGOs and private voluntary organizations in the program. So for promoting these condoms, so they have utilized the services of NGO organizations, private organizations and voluntary organizations, so that the program became successful. Then comes the HIV surveillance. Zero surveillance centers and HIV reference centers are established. So throughout India, they have started surveillance, that is they want to know the factors responsible for causing the disease. So they want to continuously monitor the factors which are responsible for causing the disease, that is HIV surveillance they have established throughout India. Zero surveillance centers and HIV reference centers are established for identification of geographical spread of HIV. So in which area or which parts of the India this HIV is spreading fastly, and which parts it is spreading very slowly. So if you do the survey in all the states, of India, automatically you will come to know in which parts, in which area the spread of the disease is very high, and how to prevent that, how to prevent the spread of the disease, and what are the strategies you are going to follow up. Everything you can plan. That's why they have started zero surveillance system for determining the major modes of transmission. So with the help of surveillance, you can come out, or you can make out what are the major modes of transmission in the society, whether it is to sexual workers, or from intravenous drug users, or through blood transfusion, and what are the different factors, or what are the different sources of transmission, what are the different modes of transmission, you will come to know with the help of these surveillance systems. So there are different types of HIV surveillance are there. HIV sentinel surveillance. So the missing cases we can find out in the HIV sentinel surveillances, and HIV zero surveillance is there. AIDS case surveillance is there. STD surveillance is there. Behavioral surveillance is there. Integration with surveillance of the other diseases like TB. Integration with surveillance of other diseases like TB, it is also there. So there are different types of surveillances among HIV, that is HIV sentinel surveillance, HIV zero surveillance, AIDS case surveillance, STD surveillance, behavior surveillance, integration with surveillance of other diseases like TB. When you look at the HIV sentinel surveillance, introduced in the year 1993, objectives best achieved by annual cross-sectional survey of the risk group. So they have taken up among the high risk group, especially men having sex with men, and then transgenders, prostitutes, intravenous drug users, as well as among the antenatal cases. So when they look at the cross section, they have done the cross-sectional study for 1 year of the risky group based on the HIV prevalence rates in adult population. The states are classified into 3 groups, that is group 1, group 2 and group 3. You can see the adult prevalence, NACO 2006 surveillance. So Manipur 1.67%, Nagaland 1.26%, Andhra Pradesh 1.05%, Karnataka, Maharashtra, Tamil Nadu less than 1%, Mizoram, Goa 0.7 to 0.80%, Pondicherry, Gujarat 0.5%. If you look at the Manipur and Nagaland, so their drug usage is very high. It is not through the sexual contact or through the blood transfusion. It is mainly because of intravenous drug users. It is mainly because of intravenous drug using, that is Manipur, Nagaland, Mizoram, Goa. So in all these places, whereas in case of Andhra Pradesh, it is the you can say it is through the blood transfusion as well as through the prostitutes, transgenders. That is most common. Whereas as well as in Maharashtra, Karnataka, and Tamil Nadu, and Manipur, Nagaland, Mizoram, and Goa, it is mainly because of IDUs, that is intravenous drug users. So behavioral surveillance. Next is behavioral surveillance. If you look at the behavioral surveillance, useful to assess the changing pattern of behavior in different risk groups of population. So how the behavior of the people in different risk groups is changing among the antenatals, among the transgenders, among the prostitutes, among the men having sex with men, or among the prostitutes. How the behavior is changing from time to time. You have to study them. You have to study them, assess their behavior, counsel them, and you need to bring behavior change communication in them. So initiated initially on pilot basis. So initially they started on pilot basis, expanded as per the needs of the program from time to time. If you look at the behavioral surveillance survey as a part of NACP2, it was conducted in 35 states from April to September in 2001. According to the survey, the awareness of HIV/AIDS has increased. The awareness is not universal. That means the awareness is present, but it is not universal. Low awareness is seen in heavily populated states, like you can see Bihar, Uttar Pradesh, Rajasthan. In those states, it is very difficult. Very low level of awareness is there because they are heavily populated. Very low awareness is seen in rural women of Bihar, Gujarat, and Uttar Pradesh. So though awareness is there to a certain extent, but it is not it is not uniformly present throughout India. So big states which are having huge population, their awareness levels is very low when compared to the other states. And moreover, in rural areas, the awareness is very minimal. The awareness about HIV/AIDS is very minimal, especially if you look at the Bihar, Gujarat, and Uttar Pradesh. So awareness among the rural women is very low. Then targeted interventions. So what are the targeted interventions they are going to do? So basic purpose is reduce the transmission of HIV amongst the most vulnerable population. Combines a comprehensive and integrated approach. That is, the main activities are behavioral change, communication. So among the transgenders, among the truck drivers, among the youth and adolescents, so they want to change their behavior. They have to change their behavior from unprotected sex to protected sex, and they want to create awareness about the reproductive tract infections, sexually transmitted infections, HIV/AIDS, its modes of transmission, its prevention, and the treatments available. Everything they want to make aware to the especially high risk people, so that they can modify their behavior. And treatment of STDs. So sexually transmitted diseases, they want to treat thoroughly. They want to treat them properly, so that they will not contract with the HIV or HIV/AIDS. Creation of healthy environments. So they want to create healthy environment in the society. And then school AIDS program, school AIDS education program they have started. So it is better in the adolescent group only. If you take 7th class to 10th class, 7th class to early adolescents, so that is the most dangerous period. That is the most risk taking period. So in that period, if you explain them about the AIDS, its modes of transmission, its prevention and control, everything, if you explain to the early adolescents, it will be better, so that they will have idea about the sexually transmitted infections, sexually reproductive tract infections, HIV/AIDS, so that they will not contract with the AIDS. So to raise the awareness level and develop a safe and responsible lifestyle in student youth. So what they have done is they have started school AIDS education program. Through this program, the children will be educated about the safe and responsible lifestyle in student youth. A training module called Learning for Life has been prepared. So they have prepared a module, that is training module, that is called as Learning for Life has been prepared. State AIDS control societies cover the students of secondary and higher secondary schools. So under the university, there is a university talk AIDS project is there, covers the colleges and schools. So for the school children, school AIDS education program, whereas for the university students, that is the university talk AIDS project is there. So through this, the main aim is they want to create awareness about the HIV/AIDS, its modes of transmission, its prevention, everything they want to explain to the student community. Information, education, communication, and social mobilization. So the objectives of this strategy is to raise awareness. Information is nothing but you want to create the awareness. Now, education to improve knowledge and understanding among the general public about AIDS. So whatever information you are sending into the community, it should be very simple so that the public can understand very easily what you are explaining, so that they can follow the preventive practices very easily. So preventive practices must be very simple and they must be able to practice at the community level without any problem. To improve knowledge and understanding among the general public about the AIDS. So finally, whatever you do, the program or the awareness what you create in the society, the people must understand them easily and they must follow the message or the information given by you very thoroughly. To promote desirable practice such as avoiding multiple sexual partners. So we are going to explain the public, you are going to explain the public about the disadvantages of having multiple sexual partners, to mobilize all sectors of society to integrate messages and programs of AIDS into their existing activities. So all the people, they will be provided with the messages and the programs about HIV and AIDS. So in all the schools, colleges, everywhere, so they are going to communicate with about the AIDS program to create a supportive environment for the care and rehabilitation of persons with HIV/AIDS. So if at all they are already having HIV and AIDS, for them you need to create a supportive environment. You have to support them, strengthen them, motivate them, so that by taking ART they can live very safely, very happily with the, the remaining people. There should not be any discrimination. And family health awareness campaigns. The objective of these campaigns are to raise the awareness levels regarding HIV/AIDS in rural and slum areas and other vulnerable groups of the population. So this mainly family health awareness campaigns is mostly in the urban and the slums, and in the rural areas, in the tribal areas, you have to go get a family meetings with the people, create awareness about the HIV/AIDS, to make people aware about the services available under the public sector for management of RTI and STI, to facilitate the early detection and prompt treatment of RTI STD cases. So at the same time, what you have to do is you have to develop medical as well as paramedical systems, professionals, so that they can identify the STD cases or reproductive tract infection cases early and bring them to the doctor for treatment as early as possible. So you have to, whenever you need any blood products, you have to get from the licensed blood bank only, which are thoroughly tested for HIV, malaria, hepatitis B. To aware that HIV can be transmitted from the infected mother to her baby during pregnancy, delivery and breastfeeding. So if you take the proper measures, definitely HIV, you can prevent the spread of disease from mother to child. So to aware that HIV can be transmitted from the infected mother to her baby during pregnancy, delivery and breastfeeding. Single dose administration of nevirapine has been started from 1st October 2001. Initially started at 11 centers. Now being extended in a phased manner, giving higher priority to 6 states with high prevalence, especially in Tamil Nadu, Maharashtra, Manipur, Nagaland, Karnataka, and Andhra Pradesh. So, to stop the spread of the disease from mother to spread of the infection from mother to child. So, nevirapine they are started in 2001. So, ART treatments. So, their priorities are there: pregnant HIV women, children up to 15 years, full-blown 8 cases. So combination of 2 to 3 antiretroviral drugs has to be administered within 2 hours of exposure, post-exposure prophylaxis. So in the next coming class, we will discuss about the post-exposure prophylaxis. Drugs are provided at free of cost to the healthcare workers in the hospital. So it is out of sight, out of mind. Thank you. So I am thinking that all are present.